Good evening. My name is Abiola Obatuashi. I am a doctoral candidate, a student at Coppin State Ellingford School of Nursing, Baltimore, Maryland. This is a Nursing 837 webinar presentation on my DNP scholarly project titled Burnout in Advanced Practice Registered Nurses and the Development of CALMNP, a resource website to manage burnout. Burnout was defined by the World Health Organization as a syndrome conceptualized resulting from chronic workplace stress that has not been successfully managed. According to statistics, 35 to 40% of advanced practice registered nurses report high levels of burnout. This impacts the job satisfaction, the kind and quality of care that is delivered to the patient, and results in increased turnover on their job. For this DNP scholarly project, the Maslach Burnout Inventory was used to assess the level of burnout in 30 advanced practice registered nurses in a clinic in Baltimore City, Baltimore, Maryland, and their results were collated to find out what parts of the burnout inventory, or what the three sections that affects burnout and the impact each of these sections have on burnout. The three sections that were measured in the Maslach burnout inventory were exhaustion, depersonalization, and personal accomplishments. The key points that were noted was the workload. Most APRNs work long hours with high patient load. This usually will result in emotional toll. Why? Because there are complex cases that we come across, and decisions that we make are life and death decisions. And also, our roles sometimes is extremely ambiguous, because we are also involved in administrative tasks and at the same time carrying clinical responsibilities. These were issues that have been in existence and were extremely exacerbated during the COVID pandemic that has resulted in increased stress and mental health issues in advanced practice registered nurses. Prior to this time, there were not really a lot of solutions available for advanced practice registered nurses. While doing research, it was observed that a lot of research has been done on registered nurses, on medical doctors, on medical students, on teachers, even on chefs. However, there were limited researches done on advanced practice registered nurses, limited accessibility to mental health support and peer networks. There have been no adequate focus on holistic long-term solutions for advanced practice registered nurses. These are the gaps that have been noticed while the research was done. So here comes CALM. What is CALM? CALM is a website. CALMNP is a website that was developed mainly with advanced practice registered nurses in mind. And the resources that are on the website are mindful exercises, guided medications, yoga videos. There are peer review forums. There's a chat room in the website looking at the mission and the vision. The vision of CALMNP is to support advanced practice registered nurses' wellness and to provide accessible evidence-based resources to combat burnout. The goal of CALMNP is to reduce burnout by 20% within 2 years amongst advanced practice registered nurses, and also build an active user base of at least 10,000 APRNs in the first year. Below is what the website actually looks like when you log into it or when you click into it. There is a self-assessment tool on the website, which is also the Maslach Burnout Inventory, that advanced practice registered nurses can use to do an assessment of where they are in terms of burnout. To come on the website would be educational content like webinars, articles, and case studies, mental health resources, which would include directories for therapists that specializes in healthcare burnout. The use of the chat room is very, very important because it gives an avenue for advanced practice registered nurses to come, meet with other nurses, have a conversation about their day, distress, seek, solutions from other advanced practice registered nurses on how to handle their stress level or their burnout level. How were the evidence-based approaches sourced? They were sourced with the use and help of a wellness expert that was recruited to help with this project. She, along with the IT specialist, were able to help put this website together with the results that were obtained via the MBI assessment that was done. And so the resources that were picked were tailored to handle the results, like exhaustion. Exhaustion was the main, with the main results that we got with the highest mean value, and the use of the chat room is to help so that people don't feel isolated. It helps to mitigate against the feeling of isolation. Other online interventions that are put on the website is to increase accessibility and for advanced practice registered nurses to have a place where they can actually decompress at the end of their day. The plan of implementation for the website is in 4 phases. Phase 1 was the development, the design, the resource creation. Again, all this was done with the help of the wellness specialist and the IT experts. The phase 2 was a pilot testing that was done with advanced practice registered nurses. 12 of them partook in this phase 2. They did go through the website and came back with their suggestions and their assessment of the website using a modified Likert scale from the technology acceptance model. And then a full launching is in place and marketing is also in place using other platforms like the YouTube, like Nurse Practice Associations of Maryland, American Nursing Association. The intent is to continue to reach out to other organizations that would support this CALMNP website. Hopefully, stakeholders, companies, businesses, hospitals, any private setting will join us to assist advanced practice nurses in fighting and mitigating against burnout. Ongoing evaluation of the website is going to continue. We're keeping a tab of the number of people that are visiting, and updates are to be added as time goes on. The expected outcomes for this DNP project with the use of the CALM website is to improve the mental health and job satisfaction amongst APRNs. And once this is done, it makes the providers feel like they have a good well-being and they're able to do better with their patients. They're able to provide better care and better help for their patients. And in turn, it reduces turnover rates and the associated costs that comes with the training and leaving their job. A call to action. A call to action is to join hands together to reduce burnout amongst advanced practice registered nurses by visiting and introducing other people to the CALMNP website. It is www.calmnp.com. Share this link with your friends and your colleagues. Invite other nurse practitioners into to this website so that they can partake of what is being offered, and all together we'll be able to help each other work through our difficulties when it comes to burnout. Thank you so much for listening. I appreciate you all.